right. Well, I say we get started. Time is valuable. Thank you all again for participating in the ADA workshops. Will Purvis with Disability Network will again be leading us in an ADA training today. We have also, Will has created a checklist that he will go over, and he has also reminded me to remind you all that Disability Network, um, Will's network, as well as other networks across Michigan, are available to support your agencies in providing a hands-on, in-person evaluation of your environment. You are interested in doing so. So you can reach out to me or to Will if that's something that you would like to explore. So I say we will go ahead and get started. Will is the Director for Planning and Program Development. And Will, are you ready to take it away?
India, yes, I am ready to take it away.
All right. Thank you all.
Yeah, thank you. Welcome, everyone. It seems like we have kind of a small group compared to previous sessions. So if folks have questions, we can make it more informal. If there's things, don't hesitate to jump in and um, with thoughts. So you can go to the next slide, India. So just really quickly, we've started the workshops sort of with a quick overview of our mission as a disability network. And then next slide. And here's our agenda for today. So we're going to be mostly looking at training and evaluation, sort of the staff or back end side of things in order to create more accessible clinic environments. We're going to go quickly through the first two because we've done those in the past, but in case there's anyone new here, I did want to share those slides. Then we're going to take probably the bulk of our time will be spent on sort of a sample of what we often use for disability awareness training. And one of the things, just as a teaser or I guess advertisement, one of the things we do with many nonprofits, businesses, clinics, is provide disability awareness training for staff, and we'd also develop onboarding materials and training materials in collaboration with groups such as yourselves. And so as India said, besides the walkthroughs and sort of physical environment assessments, one of the things that we do is that additional side of service providing. And then we'll talk a little bit about evaluation and access for staff. And then we have one workshop left later in this month, and I'll talk a little bit about that. All right, next slide. So as India said, we're a disability network where we are a center for independent living. There are 13 of us across the state. We offer a wide variety of advocacy and support services for individuals and institutions. And we're always, was that a question?
No, no. Okay.
Okay.
Go ahead.
All right. Yeah, we provide a wide variety of different kinds of services. And if folks who come in through your doors need with disabilities or even without disabilities, we're happy to support them and collaborate. We work with a lot of medical practices as kind of an adjunct to their social work services and support services. So we're happy to chat with folks about that as well. Next slide, please. So really quickly again, definitions of disability and accommodations are here. Next slide. And then, just as a reminder, we tend to think of disability in terms of sort of what kinds of barriers might be present in an environment, in a program, in accessing services. And we found this list, which is not comprehensive, but which encompasses sort of many areas of disability and many places where folks can uh, encounter barriers. And so this can be um, a useful tool to sort of look at your services or a particular area of services and say, if someone had X, then would they be able to use this piece of equipment to access this particular form or particular room or whatever it might happen to be in your clinic. So this can be a helpful way to kind of go through that sort of mental process. Next slide. So when we do disability awareness trainings, there are sort of a variety of different ways that we or talk with folks and encourage people to think through disability awareness. And this sort of has kind of five main areas. So language and interactions, um, addressing service animals and mobility devices, and then sort of how you can ask people for if they need support or not. So we're going to go through these are samples of some of the work that we do, and so in thinking about, I mean, in thinking about developing your own trainings for staff, um, and looking at, I mean, there's a variety of them out there, and different disability networks, different disability advocacy organizations, um, ADA consultants, accessibility consultants will all have their own take on it. These areas are ones that we feel are um, good to highlight so that it again, as you're looking for, to move forward, then to use this as a little bit of a checklist to kind of bounce programs off of, because if they don't talk about some of these things, then you might want to ask them if they do have that option, or if they can rework their program to include it. So next slide. So the first piece that we really work with folks on is sort of greetings. And this parallels the ADA in some ways, because one of the first things that we look for in terms of accessibility is how do people enter into your environment from a physical standpoint. How do people get there? What is the way in which they engage with you that initially? And so thinking about and talking with staff about how they greet people, um, and how they interact with them um, in the clinic environment is going to be really important. Um, and thinking about um, how you're reaching for someone's hand if someone can't extend their hand, how do you make sure that that's comfortable for them? And these are all examples of things that have happened to our staff in a wide variety of ways. Um, so any questions here on engagement and greetings?
Well, this is India.
Yeah.
I just wanted to add that when speaking with individuals who may be in wheelchairs or some seated position, that maybe lower yourself or squat or grab a chair so that you're on, I guess, equal level, versus hovering over someone. Um, I, I, I think that's one of the things that I try to practice.
This is Will. Yeah, that's something that we do mention when it's convenient. Sometimes it's especially in a clinic environment, if you're in, say, an exam room, there may be multiple people, a scribe, a physician, in addition to someone else. And so sometimes the seating doesn't work out in that respect. And it's also so we tend to suggest, to do exactly that, as long as it's convenient and possible in the environment. Sometimes it's really, really difficult. And then other people may have trouble squatting or leaning over as well. So that's something to keep in mind too. Next slide. Okay, so this one is really pretty critical, sort of talking directly to the person with a disability. There are going to be, and I'm sure many of you have encountered it, folks who come with a caregiver of some kind. It could be a family member, it could be a personal assistant, um, and in many cases, the conversation starts to be routed through the caregiver, um, and without referring necessarily to the person with the disability. So thinking about how you're approaching and thinking and talking with um, someone with a disability and with an assistant, um, sort of avoiding language like "do they want to," "would they like to," um, and then, as India said, adjusting your posture to eye level if needed or if convenient. And then we talked about this in the first session, sort of looking at your kind of communication um, tools that you have available for your staff. So using sign language or an interpreter. And when using an interpreter, to look at and direct your conversation to the person with the disability and not to the interpreter. That happens fairly frequently with people who are deaf or hard of hearing who are using an interpreter. Um, any questions here on these kinds of tools? One of the things I think too, with this is that there are going to be people, especially if you're working with folks in the IDD population, there are going to be situations where talking to the caregiver through the caregiver is necessary because the person may be nonverbal, and may require a fair amount of assistance in sort of interpreting your questions. And so there's going to be, for some folks, there's going to be a bit of a dance here, sort of in terms of working with the caregiver and working with the person with the disability. Um,
This is
yeah.
oh, this is India. I would like to know if, I guess, any of you all have engaged sign language interpreters in your clinics, and how that's working out for you, because um, at the center we hear a number of stories around individuals who are deaf or hard of hearing, seeking care, including care at the emergency room and in the hospital. Have you all experienced any interactions or, um, I guess, requests or needs for ASL interpreters?
Uh, This is Miriam. We use ASL interpreters through a service on an iPad, usually when families need it. It's the same service, I believe, that gives us our other languages. And it's been pretty helpful. Sometimes it's difficult when we're trying to do treatment on a child and they need it because, you know, it's hard for them to see the iPad while they're laying back and we're working. But so far it's been pretty helpful with the families.
That's good. Thank you for sharing. Any other comments?
We do the same. We haven't had a request for it yet, but it's the same service that we use for all of our other language interpreters. They also provide ASL.
I'm curious, would you all mind sharing the name of this company?
I would have to ask someone.
Oh.
I'm sorry, I didn't set it up, but I will ask them and send it to you.
All right,
So
thanks. And
ours is Language Line, but I think they've changed because we pay one and use another, but Pacific Interpreters. And I think they're the same company as far as I know.
all right. Thank you. And I will add that there is also I believe a bit of a shortage for ASL interpreters to provide medical interpretation and healthcare. From what I've heard, it was one of those pandemic fallouts. So thank you for sharing. Okay, well.
Yeah, this is Will. Thank you, India. We can go on to the next slide. This question comes up quite a bit on languages and language and labels. So we tend to default to what the person wants to be described, and some assumptions of labels can be misinterpreted or even hurtful. There's a lot of historical terms that are no longer acceptable. We have more inclusive terms now. And the default often is using language that puts the person first and acknowledges that some people with disabilities shouldn't be defined by other persons. So a person who is visually impaired. However, some people with disabilities prefer disability first language, such as I am autistic or I am deaf. Myself, I use I am blind uh, to define myself. So, and as I've lost vision, I for probably 5 or 6 years, I used I'm a person with a visual impairment or I have trouble seeing. And then I shifted over to that, to using blind as my vision really deteriorated. And also, just from a personal note, as I got more comfortable and accepting of my disability. So there's a variety of reasons people will use in terms of describing themselves, um, the words that they use for their own identity and their identification as a person with a disability. And there are certainly plenty of folks that we work with who have a disability who would not describe themselves as a person with a disability. They describe themselves as, someone with medical condition X, Y, or Z, and don't think of themselves as a person with a disability. So it's always good to ask first, check in with them. Any questions here?
This is India again.
Yeah.
Yeah, I do have a question. How would I go about that if I am providing a service in my clinic, and there's an individual who has a disability? They may have noted that on their medical chart when they were checking in, perhaps. And I'm coming into the room, first time I've met them. How would I go about asking this question?
Yeah, so I mean, using myself as an example again, so I would be entering in with my white cane, and you could say, I noticed you're using a white cane, or is there what kinds of word would you use, or what kind of how would you describe yourself? And how would you prefer for me to describe you? And you can offer up, some people prefer visually impaired, others use other words. So I think just asking um, is usually pretty straightforward. Um, uh, and coming from a place of respect and interest. Does that answer your question, India?
It does. Thank
Okay.
you.
Um,
And I was just gonna say, so my daughter has a disability, and growing up or going through the special education system, it was always referred to, or we always referred to it as she has a special need. And after taking some of these workshops, through the last few years, I've been trying to switch to like instead of asking if someone has special needs, or do you need any accommodations? What accommodations do you need? So I think it is a challenge, especially if you've come accustomed to using a certain phrase or language, to switch to something that might be a little more inclusive, or better, but it's something that I work towards. But that's been one I think that helps, is what accommodations might you need, or um, is there any way we can accommodate you?
right. Yeah, this is Will, and I completely agree with you. And that's sort of the bottom line, is asking, what kind of support do you need in this particular, when you come to our clinic, um, you know, what can we do to make to support you as you move through this process? Um, and yeah, um, everybody's going to be different in their responses to that. Uh, so that's a really good point. Next slide.
This is India again.
Yeah.
Thank you, Kate, for sharing that about your daughter and your experience. At the center, when we offer our events or when we post our registrations or meetings, you may have noticed in the announcement, we do ask. Well, first we state that we will have, CART or ASL if we are going to provide that, but we also use the language of please contact us if there are other accommodations that we can provide. Um, at the center, we've been thinking about this, I guess, trying to make things as easy and simple for providers to support everyone. And perhaps just a simple addition of when an individual either utilizes an electronic device to, um, I guess, to seek an appointment for your services, or when they call, just the simple addition of asking, are there any accommodations we can provide to you at the time of your visit? Um, it's quick, it's easy, a yes, no, and then if it is a yes, the individual or their caregiver or their support system would likely identify exactly what's needed, which one, you may not be able to offer that. And if you can't, you can state that, but it would also be noted and everyone that's involved in this upcoming visit would be aware. So it's not, oh my goodness, what do we do because India just arrived and she needs XYZ accommodation. So I just wanted to add that. Just a simple statement or question about accommodations is helpful.
Yeah, this is Will. I think we mentioned that last time as well. And I think the caveat there is that I know probably some of you are using systems, electronic record systems and other kinds of portals that may not have as much flexibility as you'd like in terms of the kinds of questions you can ask. So that it becomes even more important when you have that phone contact or when the person actually arrives to just double check. We can go on to the next slide, India. This one, definitely, if someone has a speech and language issue, just ask them what they said if you don't understand. And if you try 2 or 3 times, then and you still don't understand, don't pretend to understand, but try to find another means of communicating with that individual. So you can write it down. Some of you said that you have iPads available. There are text to voice devices, a lot of different communication aids that can assist people. Some people will arrive with them. Other people may not. And so having an audit of what kinds of devices you have available and what kind of supports you have available is always pretty helpful. Next slide. And then with regard to personal space and mobility devices, service animals, always take direction from the owner of the mobility device in the service area and sort of the service animal and respect the space. So service animals, as probably most of you know, they're extensively trained and that when they're in the clinic, they're most likely working. And so, interacting again with the person and not with the animal is the priority. And next slide. And then this relates back to what I think someone was saying earlier, is asking first. And if say yes, then how you can help. So this underscores what India had said as well. And even when someone looks like they might be struggling, they may be able to do it. It just may take them more time, or they may be working on that particular task. So asking first is always sort of the first thing to do. I think we're done with this section. Are there any questions? We can go on, I think. Oh, questions. All right. So the next section is there's a couple of slides as we move towards some of the checklists and things. So one is training and onboarding. So as we've said kind of all along through the summer, through these 3 workshops, that training is really critical for staff, and moving towards a more accessible workplace, having trainings in place for the staff is probably the most important thing that you can do. And then I'm sure you've all been through loads of training, both formal and informal and ongoing training. So I don't think I'm saying anything, new here by keeping it targeted, keeping it relevant. It's often, better to use local experts and experienced staff. It's often cheaper as well. And we really, really advocate using trainings to establish a baseline with current staff, and then adopting an onboarding module or unit. So all new staff are on the same page, and over and over again, we've seen that there can be a lag or an assumption after everyone goes through a particular training. You sort of assume, oh, everybody knows about X. And then new people come on and they're not doing whatever X was about. And you say, well, weren't you at that training? And they say no. And so with the rate of turnover being what it is in many places, moving that sort of critical training towards the onboarding side of the equation can really help in terms of moving clinics and other practices towards more accessible spaces. Any questions about that? thoughts?
Wondering how we can support people attending virtual meetings.
And can you say more about that in terms of what kind of support?
Well, if somebody's attending one of our meetings and we're using visuals, but they are visually impaired, how do we support that?
So a couple different ways. One would be to provide the slides and materials ahead of time, so that they can be, reviewed, depending on the level of impairment. Someone may use a screen reader, or they might need a magnification device. So having that ahead of time is always helpful. Um, Minimizing the use of complex graphics and illustrations in your presentations is often really helpful. And then if you do have them, providing good sort of robust visual descriptors of those illustrations. Then on the back end, sort of, or the is recording them and having them available so that if someone needs to go through it multiple times, they have the opportunity to go back and listen to what the presenter was saying or elaborating on with a particular slide or a particular point. Does that answer your question?
Yeah, thank you.
Yeah, you're welcome.
I'd like to add that the center has open office hours. Those are scheduled on forgive me, we've just changed them. I will email everyone the Zoom invitation, and this is open to anyone in the world. It's an hour a month where you can pop on and speak to a disability health researcher, staff member, and ask any questions you would, specific to your needs, something that just came up, something that's been lingering, assistance regarding perhaps providing accommodations, as you said, for meetings that are conducted virtually. But yes, I appreciate your question, and I will send out that invitation, and feel free to share it with others and hop on, hop off with your questions. Okay.
All right, next slide then. Evaluation and planning is another sort of back end side of things. And so regular accessibility checkpoints, looking at metrics and evaluations can be really important in maintaining accessibility, as with other areas of practice. So again, keeping it targeted and relevant to your current capacity. You might not be able to do an accessibility walkthrough, or you might have done one, and you have $200,000 worth of improvements that you'd like to enact, but you can only afford $20,000 for that year or less, or whatever it might happen to be. Sort of, your capacity. So doing an honest assessment, an honest evaluation, and then saying, okay, here's where we are now, here's where we want to be. And that helps keep the ball moving forward, and on the administrative side and on the planning side. And then when you are looking at evaluation, look at including all your constituents, both patients and staff. And then as you gather results, and is to record and publish them and use them sort of to iterate forward. What's the next thing that we're going to do? What more can we do in this particular area? And having that regular evaluation and planning process can be really important in developing a more accessible practice. And so that's another side of the things we work on with some organizations is that strategic accessibility thinking and how might that be implemented. Next slide. And then thinking about how an accessible clinic can also be accessible to staff with disabilities. So many places we work with sort of over focus on the client side of the process and accessibility, and less on staff. So thinking about the walkthrough, thinking about the space, all of those things are important for the staff as well. And just some questions to ask regarding staffing is, does your HR provider or your HR process have a robust accommodation procedure? Many places don't. That's been our experience. So having one is good. And then, so sort of the related to that is, are our staff with disabilities comfortable in asking for what they need? In many places, people with disabilities don't. They are scared to ask because they think they're rocking the boat, or they might be fired for asking for something that will make their work life easier for them to adjust to. And going through, like we've talked about, these accessibility checks and audits, and both in the staff areas of the clinic, and are there areas or equipment that cannot be quote universally accessible? So there's going to be equipment that you can't make accessible at this particular time, whether it's because of the design of the equipment itself, or the expense, like we talked about before. So noting those, and then in your job descriptions, do they accurately reflect what is needed for the job? So if using a piece of equipment that's not accessible is there, then you should say, must be able to stand to use and have a reach of X inches in order to access this machinery. Things like that are going to be important, so that when someone does apply for that position, you can say, no, I'm sorry, we can't make an accommodation for that particular function. It doesn't mean you shouldn't hire them, but it just means that you can't accommodate them. And so that their job description may need to be adjusted. A lot of times too, there's sort of legacy language. A lot of job descriptions come in, they're sort of boilerplate. And so, for instance, it might must have a valid driver's license. That's something I don't have. I have a valid state ID, but I don't have a valid driver's license. So just checking those kinds of things. Does the language really fit what the person is in that role really needs to be able to do? I think that's the last slide before the checklist. Any questions here? All right, we can go on, India. So this is the last time we met. There was a request for sort of a quick accessibility checklist. And so this is, don't, this is not an official document. This is not an 80, this is the, don't use this for any sort of formal process, or submit it to anyone who might look askance at this. This is for your own use to sort of do a quick go over of your space. And like we've said a couple different times, we are more than happy to come in and support you in this effort. If you need something more formal or want something more formal, we're totally happy to do that. So sort of going through this, can, as you walk around your building and look at your facilities and look at your services, this is a really good, hopefully it'll be useful checklist for kind of doing a quick scan of your space, of your environment. Any questions here? I know India said that they had some. And this is really it. The only other thing was next time we meet is going to be focused specifically on dental clinics. So we can, this is really the last thing. So if people have questions about this, and I know we have a couple minutes left, so I can spend some time here if people want.
Well, this is India.
Yeah.
I'm looking at signage and wayfinding and alternative formats. Could you share what alternative formats are and provide some examples?
Yes, this is Will. So that would be having either Braille or raised. That's probably the biggest one. Either Braille or raised letters are becoming more common now on signs because Braille education has kind of fallen off. There's more and more people who are blind or visually impaired who do not read Braille. So if you're updating your interior signage or your wayfinding, having signs that do have raised letters or Braille or both can be really really helpful. This goes to also exterior signs, so like entrance and exit signs, things like that as well can be helpful. It's also useful. Alternative formats can also include pictures and symbols that can be helpful for folks with intellectual disabilities or who are non-literate. We also have seen a number of places successfully using color to indicate different areas of a building. You know, if you have a pediatric clinic, for instance, then if the carpet or the paint in that direction is, for instance, green, and everywhere else it's red or beige or whatever, it becomes really easy to direct people. Just follow the green hallway, or just follow that whatever color it is to get to particular point. That can be really helpful. Obviously, it doesn't help people who might have difficulty with color blindness, but having a variety of different formats sort of makes that wayfinding, that direction giving circle much larger. Does that answer your question, India?
It does. Thank you. Any other questions or thoughts? Okay.
All right. Well, this is Will. So the last thing, like I said, was next time we'll be focusing specifically on dental clinics and looking at communication, treating and working with patients with communication barriers, disabilities, and visual disabilities, and also working more intensely with caregivers. And just because we're talking about dental clinics doesn't mean that the information wouldn't be sort of more widely usable, but when we put the workshops together, this was a request and thought that required a little bit of a deeper, we thought could use a little bit of a deeper dive.
Hey, I believe I saw your hand up.
I was actually going to ask that question about if the information would be relevant for non-dental organizations.
I think it probably would. And it's going to be probably really focused on people with communication barriers. And thinking about the people who come in with specifically visual disabilities and intellectual disabilities, and how, especially in a dental practice where it's a very generally sort of at the time of visit, there's such a a close physical proximity. And it's often, not that that doesn't happen during a regular doctor's visit, but with like say with a cleaning, for instance, can be, it's a different kind of experience. And folks that we've worked with who work with or take care of children or other folks with intellectual disabilities, especially folks who are nonverbal, have said that going to the dentist is can be a very sort of fraught experience. And so that's one of the reasons. But I think a lot of the information will be transferable. That's a long answer to your question. I should have just said yes.
I just wanted to, this is Kim. I wanted to jump in and say that this is great, William. Thank you so much. And also, one of the things that I've been thinking about as you're speaking is about the overlap with caring for older adults who may have disabilities and may not, but still just the asking and kind of watching for how things are, how communication is working.
Yes, thank you. Yeah, thank you for the compliment. And also, yes, absolutely. So much of what we've talked about here is transferable to working with seniors. And there's a old sort of line in the disability community that, we're not we're not in a world, we don't live in an able-bodied world. We live in a world that is temporarily able.
Mhm.
And that folks are going to be encountering and living with a disability at some point in their life, or at many points in your life. If you break a leg, or whatever it might happen to be. So yeah, very applicable.
Thank you for that, Kim. This
Yeah.
is India. I wanted to add that I have identified a number of items that we will be putting into kits for you all, providing support for individuals who have sensory, IDD, less physical disabilities, but it includes things such as large magnifiers, fidget spinners for those that may need some type of tactile support. I believe I also included some things like sunglasses that may help someone feel more comfortable with the lighting situation. So we will be putting those kits together and getting those out to all the clinics, hopefully in the next month or so. That's just something that we wanted to provide in addition, to help support your work that we greatly appreciate you doing. I will also send out the information regarding the open office hours, and even if it's a simple question and you have 3 minutes, hop on, ask your question, get your answer, and you can hop off. Kim, did you have any more comments that you wanted to share before we sign off?
Me? Kim? Was it Kim?
Yeah.
I just want to, if we sent out an email inviting everyone to a grantees meeting on November 3rd. It's a Blue Cross meeting, but Dr. Mead, I think, will be there, and others potentially from the Center for Disability Health and Wellness. And it's going to be a really interesting day where we have a consultant coming in from Blue Cottage Cannon Design to teach change management, and then there will be sort of pop-up presentations with people offering resources for the grantees, and there'll be funders woven in throughout the day. So if you could use some extra support to make some of the changes you're thinking of, or have other needs in your clinic, please take a look at that. I'm Kim. You might not have put my face with the name when you received the email, but we highly recommend it. I think we're going to make it worth your time. I promise you that. So maybe we'll have some kits on the tables. Who knows?
Oh, that would be great because I ordered 12. So where is this meeting taking place?
It's again November 3rd, and it's from 10 a.m. till 2 p.m. Lunch is provided. There is no cost for to you all for attending. And it's at the Kellogg Hotel and Conference Center in East Lansing. So RSVP, if you want to come, you're welcome to bring one person from your clinic, but no more, because we will run out of space. But it would be great to meet you all in person. And I know that the U of M team feels the same way. So it'll be fun to be together.
Wonderful. Thank you so much. Will, did you have any final comments, or are we all set till I believe it's the 29th or the 30th?
This is Will. We are all set. I think it is the 30th. It's the last Tuesday. So that makes sense. That's 4 weeks from today.
Okay. Thank you. And regarding the recordings, yes, we will make the recordings available. I am having our professional editor take care of that. Kim happens to be a relative of Kim's, just coincidentally. So once we get all of those finalized and professionally reviewed and edited, we will send those out to everyone. And they'll also be posted on our website.
Thank you
All right,
so much.
great. Thank you. If anyone would like to hang on for 1 minute to speak about the actual grant funding regarding your specific grant, I am available. If not, I'll say farewell until the end of the month.